According to the Australian Institute of Health and Welfare, 70 to 90% of people will experience some form of lower back pain at some stage in their lives, while 14% of the population experience constant or persistent back pain. A variety of interventions may be used for the treatment of lower back pain. These include physical therapy, pharmacologic therapy, surgery, and alternative treatments such as acupuncture, meditation, spinal manipulation, and massage. This presentation looks at opioids versus physical therapy for the management of chronic back pain, a literature review consisting of 11 studies. There are conflicting reports regarding the use and efficacy of opioids for the treatment of chronic lower back pain. While opioids may be of benefit in the short term for managing chronic low back pain, there is scant evidence to show that long-term use of opioids is effective in alleviating lower back pain. The complications of using opioids long-term may outweigh any benefit. Long-term use of opioids leads to the need for an increase in dosing requirements and a decrease in their effectiveness, while the common side effects of opioids include sedation, dizziness, nausea, vomiting, constipation, and respiratory depression, delayed gastric emptying, hyperalgesia, immunologic and hormonal dysfunction, muscle rigidity, and myoclonus are other less common side effects associated with opioid use. Assessment tools that are mentioned in this article include the Diagnosis, Intractability, Risk and Efficacy Score, which assesses adults in primary care for the risk of opioid abuse and the suitability of candidates for long-term opioid therapy. The Oswestry Disability Index, which is used to measure a patient's permanent functional disability and the ability to function in daily life. And the Roland Morris Disability Questionnaire, which measures the level of disability that a person suffering from lower back pain experiences, and assesses physical ability and activity, sleep and rest, psychosocial, household management, eating, and pain frequency. Exercise is commonly used for treating lower back pain. While studies have shown that exercise therapy reduces pain and improves function in people with chronic low back pain, improvements were small but statistically significant. You don't need to be an Olympian to participate in exercise therapies. Supervised exercise programs have been shown to be of most benefit for improvement in pain and disability. As well as reducing pain and disability, the benefits of exercise include an improvement in mood and a lower risk of depression, an increase in sleep quality and energy, and a reduction in stress levels. The types of exercise therapy shown to be beneficial include trunk stabilizing and strengthening exercises, and stretching and progressive endurance exercises. Low-impact aerobic exercise, such as walking and aquatherapy, are beneficial for the relief of lower back pain by increasing the flow of blood and nutrients through an increase in the heart rate, while movement decreases the stiffness in the back and spinal joints. Strengthening the muscles of the trunk help to reduce lower back pain. These muscles include the rectus abdominis muscle, the internal and external abdominal oblique muscle, the transversus abdominis muscle, the erector spinae muscle, and the gluteus muscles. While there is evidence that supports physical therapy for the treatment of chronic lower back pain, there are conflicting reports on the efficacy of opioids in treating lower back pain. Further research needs to be conducted on the use and efficacy of opioids compared to physical therapy for the management of chronic lower back pain.